Hey guys, so we're going to do a modified setup of a sideline hip car. This is going to really help you dissociate because some issues with the sideline hip car is that people sway a little bit. So we're going to have a couple leverage points where you're actually really blocking, and I want you to feel that rotation through the hip. So cars are done with control, so a little bit of tension, control, you radiate tension through your body. And we're going to use a wall as well as our hands in this position to be able to do it. So you're going to be side lying on one side, the other side up, right? So I'm going to be here. You won't be able to see my head, but I want you guys to see my hip here. So arms are going to be out, push through the bottom and pull from the top to stabilize. Now my foot is driving into the wall. So make sure you're close enough that you can really drive and straighten that down leg so it can work. Holding with the arms there. Now I'm going to take a breath in, trap the air in my lower abdomen. I'm going to move this upper leg. So I'm going to slowly bring it up to my end range of flexion, driving into the wall with that down leg. I'm going to abduct or open the leg as high as I can go. Then I'm going to internally rotate and reach that back while keeping that drive into the wall and around. So we're going to then come back and reverse that. So extending the hip, externally rotate, pulling that hip up, keep the load into the wall, pushing. It allows you to get this end range of motion at the hip and more stability. So knee towards your chest, abductor, open the hip, internally rotate, reach back, keeping the knee as high as you can, and extend and around. Reversing, extend, coming all the way, pulling back up and around. If I do the other side, you guys can see the back side of it. So again, driving my leg into the wall, stabilizing with my arms, knee up towards your chest, opening or abducting, and then internally rotate hip and reach back and around. You want this hip doing the work here. Extend the hip, externally rotate, pull up while you're driving into the wall. Good. Try to make the biggest circle your hip can allow. Last rep here. Knee towards your chest, open up, internally rotate, reach back while you drive into the wall. Coming around, extend the hip. We're radiating tension through our body and making the isolation happen at that hip joint. That's just a variation on our sideline hip cars. Give it a go and let me know what you think.